The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, bariatric surgeon Dr. Scott Stowers with My Bariatric Solutions helps his patient lose weight. Learn more about the outstanding medical facility Houston Northwest Medical Center. Craniofacial and plastic surgeon Dr. David Jenikov walks us through the process to treat a child born with a cleft lip and palate. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I struggled pretty much my whole life. I was always the big kid, and being that I am almost 5'9" tall, plus being heavy is, weighs on your mind a lot. Even though I was still active, I still was a volume eater, and turned to that really for emotion more than anything. You just get to the point where you struggle with it, you do a diet, here it works, you gain it back plus 10, and that was a yo-yo effect of my life.
When Shannon came to see us, she was unable to lose in other methods. She'd tried multiple ways to do that. She also had several other health problems that she wanted to remedy.
I wanted to make a lifestyle change, period. I was nervous, but I was ready. As scared as you might be, especially I had never had a major surgery, I was ready to go. And I felt very comfortable having met Dr. Stowers. I just felt like I was in the best of hands.
Fitting into her lifestyle was a big part of the selection process for her. She didn't really need our more advanced surgeries or bypass, so a sleeve fit her lifestyle more. At 3 months, most people lose about 20% of their body weight. So you can multiply 20% how much you weigh, and that's a pretty typical sleeve loss.
That first 6 pounds was great, and then, before you know it, it's up to 20. And you put on a pair of sweats that were your comfy sweats and they don't fit. So you got to tie them for the first time in your life. And that's a great feeling.
I've seen Shannon after 2 years now. I had to look at her old pictures and look at the new ones so I knew who she was. It's an amazing transformation.
After having gastric sleeve procedure with Dr. Stowers, I've lost a total of 110 pounds. Looking in the mirror is when you've seen yourself for so big for so long and always been the pretty face. It's almost surreal. I still sometimes see myself as that person. And then lifelong friends are like, I don't even recognize you on the street. People you went to school with don't know who you are. Knowing that the work you put into it yourself makes it very rewarding for you.
If you can work up a sweat for just 1 hour a week, you can reduce your risk of heart attack, improve overall mood, and lower blood pressure.
Preventive medicine, first of all, is my favorite kind of medicine to practice. It is exactly what it says, preventing illness, really. There are certain things that through years of practicing medicine that we know occur at certain ages in certain types of people, depending on their family history, depending on their own medical history. So there are certain things that we can look at and focus on to help that patient stay well.
I've been a patient with Dr. Brame for about 10 years. Preventative medicine, in my opinion, is just trying to keep yourself healthy, making sure your diet is right and your exercise is right. It's actually more relaxing and satisfying getting preventative medication. Then you're not always a bundle of nerves. First of all, he's very good about sitting down with you and explaining every part of your health journey. Very patient, he's a very good listener.
Carolyn's a healthy lady. She takes care of herself. She comes in at her regular visits as they're scheduled. We do her blood work. We to her vaccinations. We talk to her about all of her cancer screenings, all of her other screenings.
My relationship with Dr. Brame has been very consistent. As a friend, a family member, I've seen him in my church, and I trust him with my families and their health. My husband and I have 6 children between us, and we all go to Dr. Brame. So peace of mind for me knowing that my children are also healthy. So I never have a problem referring Dr. Brame to any other friends or family.
I think a rapport or a sense of trust is instrumental in the care that you're going to have with your doctor.
He gives me a portal to get up-to-date medical information, lab results.
When we say practicing medicine, that's what we do. We practice medicine. Every case is different. Every case has to be adjusted and customized for that particular patient at that particular time with that particular complaint. I think that's vital for them to be able to trust me. They've got to feel like I'm listening to them and can then fully respond to why they're there.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the 3rd largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care about every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more than ever. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times?
Amy has a question for Dr. Collins Hodges. At what age should I have my child in for therapy?
Parents are essentially the experts in identifying patterns of behavior in their children. And any significant deviation in patterns of behavior, particularly behavioral patterns, if you're noticing things that are just out of whack, things that just aren't right, all of a sudden you see temper tantrums that are completely off the board, acting out when it isn't usually typical of your child to do so, a lot of withdrawal, child isn't eating, child isn't sleeping enough during the night, child is making unusual statements that are troubling. I would say that there is no right time to bring in your child. I would say that is the time to bring in your child.
Ask our doctors on bestdocsnetwork.com.
At 20 weeks, we found out we were going to have a baby with a cleft lip and palate, and we were looking for a doctor, a craniofacial surgeon, and we found one of the best. And we feel very lucky that we had found Dr. Jenikov.
We could see something, but we didn't ever put two and two together. We had no idea. We went to some other doctors that kind of put some things in our heads that I didn't really appreciate at the time. But when we got down here and saw Dr. Jenikov, he put us at ease a whole lot.
Fortunately for us today, 80% of the patients we see with a cleft lip and palate are diagnosed on ultrasound around 20 weeks. So we get to see the patients before they're really patients. We get to talk to the mom and the dad and really begin the education process at 20 weeks gestation as opposed to 2 weeks after the baby's born.
He guided us through the whole thing and treated us along with Tate. He kept us where we needed to be.
That first surgery was pretty sweet when Dr. Jenikov, here we had to hand off our child that we'd fallen in love with the face that we got when he was born. And after that first surgery, when we were in the waiting room waiting and we knew he was in recovery, and Dr. Jenikov actually came and got us, and he wanted to see the reaction on our face, to see his little face for the first time, and that was sweet, just knowing that it was his reward.
Tate's a normal kid. He's got a big brother that he fights with all the time. He goes to school, he runs around, he chases everything else he can chase, and he's a wonderful, sweet kid.
We've just been real careful and made sure that this is not who Tate is. This is part of our journey. This doesn't define us of who he is. We're not going to use this as a crutch in our life.
We are using it as an experience to make us a better family and a closer family. And Dr. Jenikov and his office have made this, for a rotten situation, the best experience I think we possibly could have had.
Find out more about your family history. Finding out what your grandparents died of can provide useful and life-saving information.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. The fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Coming up on the second half of today's show, cosmetic dentist Dr. Guy Lewis talks about some unique procedures in dentistry he has developed. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini Microinvasive Surgery. as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I had always dreamed of having just a perfect smile. When you walk into a room and you smile, everyone notices you. I would smile in pictures, but I would always be very critical of it. It was never the smile that I was happy with.
People who are candidates for veneers are usually people who have crooked teeth, who want them to look straighter. I was kind of one of the pioneers in a process called instant orthodontics, where instead of going through braces to straighten the teeth, we can make the teeth look straight by doing veneers.
So when I first came in, I didn't know what I wanted. I just knew that I wanted a pretty smile. They took a bunch of pictures and they listened to my concerns. The best option for me was the G. Lewis veneers because they're very thin and it wouldn't require any changes to my teeth as is.
People normally come in for a consultation where I just look at their smile, listen to what their concerns are, what they're wanting to accomplish, what they like or don't like about their smile, and then we try to custom design a plan for them. I developed some other kinds of veneers called G. Lewis veneers, which are a non-prep veneer. And what that means is that I can do those without having to do anything to the teeth, without grinding on the teeth, without reducing the teeth at all. For people who have fairly straight teeth or teeth that kind of have a cant inward, they're a great option because you could do them. You're not doing anything to the teeth. This was a way that we developed to make them look great and be very non-invasive.
I actually like coming to the dentist when I come here. Every time I come in, I feel very welcome and I feel like I'm almost just like part of the G. Lewis family. Now I smile all of the time, every time. Everyone always compliments me no matter where I go. I have people come up to me and they say, "Your smile is gorgeous." The best part about it is that it looks so real. Now I have a perfect smile.
Request an appointment on bestdocsnetwork.com.
Doctors used to prescribe hormones for all menopausal women. We thought it was good for their symptoms, and we thought it also prevented heart disease. Well, we were wrong. Studies about 8 or 10 years ago showed us that it really might increase the risk of heart attack and stroke and breast cancer. However, don't be afraid of hormones for short-term and small doses, especially if you have 3 of those important menopausal symptoms. And those are moodiness, hot flashes, and vaginal dryness. If there's a mild and don't bother you too much, don't worry about it. However, if they're severe, it will not hurt you to go on hormone replacement therapy for just a little bit of time. You can do it for a year or 2 at medium to low doses, and if that doesn't work, you can use higher doses. Generally, you're just trying to get over that hump of those symptoms, so there's no reason to suffer that way. Now, if you've had certain kinds of breast cancer, hormone replacement therapy is not going to be for you at all, no matter how you feel, so you'll just have to stay away from it in that case. But in general, if you have those big 3, hot flashes, vaginal dryness, or moodiness, hormone replacement may help you and those people around you.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we performed a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation. And patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
About 20 years ago, I started jogging and been quite an avid jogger during that 20-year time period. About 10 years ago, I tore my medial meniscus, and I had to have some surgery done on it, and went back into jogging. And then about 8 months ago, I started having trouble again with my medial meniscus.
Phil's a middle-aged, 50-ish age patient that was, playing some sports and twisted his knee, felt a pop, had a little bit of swelling, some medial-sided knee pain. So we evaluated him, we got an MRI. It showed that he had a meniscus tear. The meniscus is the structure between the thigh bone and the shin bone that provides cushion for our knees.
I went to Dr. Chris Wong. At that time, he put me into some rehab, and then we both decided that I needed some surgery done.
What we did was look inside of his knee, arthroscopically, making 2 little portholes, and then trimmed out the torn part so that it doesn't rub and cause him pain. Most things can be treated non-operatively, sprains, strains. However, things that need surgery are like large meniscus tears, loose bodies, people that have knees that are locking or getting stuck due to structures getting caught in there. And we can now, do surgery through 2 or 3 little bitty holes.
Going into the surgery, I think we're all nervous when we have a surgery done on us. That's just part of being human. But it went very smoothly. Dr. Wong and his surgical team, where I came in, visited with me shortly before the surgery. We went in. I was there about 3 hours, maybe 4. And out, they arranged to have physical therapy rehab machine that was put on the knee, and faithfully used that for about the next 4 weeks. And I've been on several recent trips where I've walked an incredible long ways and done some limited jogging, and it's worked out very well for me. Bottom line is the knee is better, significantly better, and within a few days I was back up and walking and doing quite well.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
At Fort Worth Fertility, what we really want to do is help our couples get pregnant, and we really believe this is the place for them. We can provide them with the best care from an emotional standpoint, from a success standpoint, and we can make you feel like you're in a unique situation here where we'll treat you as an individual, and we'll do the very best we can to help you achieve your goal. We look for unique situations for our patients. We try to tailor what their individual needs are. I think the importance between our center and other centers would be we're very upfront with patients. We let them know what their expectations to get pregnant are. We let them know what it's going to take to get pregnant. We know financially what it's going to take for them to get pregnant. In addition, we offer numerous treatments. We offer inseminations where we put sperm inside the womb. We offer in vitro fertilization where we'll put embryos inside the womb. We can offer surgery, we can offer fertility medications, and there's a host of other things we can offer patients at the center, everything under one roof for the convenience of our patients. Our typical first patient appointment is where we'll actually spend probably about an hour talking about things. We'll talk about their history, we'll talk about possible evaluations they may need, and then we'll even start talking about potential treatments. When we talk about treatments, we'll let them know what their chances of getting pregnant are, how much it's going to cost, and what do they need to do. And so we really try to evaluate it thoroughly so we don't miss anything, so we can give them the best options to get pregnant. We're very proud of our egg donation program and surrogacy. We're known internationally for that. So it's not just Fort Worth. You think, oh, we're just doing things in Fort Worth. But we really see patients from all over the United States and all over the globe. And we're honored enough to be able to treat those type of patients here in Fort Worth. The other aspect here at Fort Worth Fertility is our staff. I think we have an outstanding staff, and we all need to work as a team to get the job done. We do know there's a lot entailed in helping our patients get pregnant. But we do try to find a cost-effective means to try to get our patients pregnant and give them our best advice on how to accomplish that.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
I would always feel uncomfortable bending over to tie my shoe. I felt like that one day I wouldn't be able to bend over to pick up my grandchildren without feeling that, and I didn't want to put myself at risk and not be here for them one day or my family. I was starting to have issues with my blood pressure. I had to have a dual line pacemaker put in, and my health was deteriorating to the point that we needed to do something.
So he got interested in gastric bypass after his wife had it, and he's had an amazing result as well. He's lost over 100 pounds, he's off his medications, and his quality of life is just great.
I think my highest weight was like 280, and I'm now down to 161. I've came off all of my heart medications. The only thing that I take is my vitamins and my protein, and then I eat normal. I just watch what I eat, but I've come off all my medicines. I take one baby aspirin, and that's it. I was just having one problem pile on top of another one, and ever since the gastric bypass, it's been like completely opposite.
Walter's biggest medical problem was his high blood pressure. He was on a couple medications, and in spite of that, men are often much more hesitant to come in for surgery. There are equal numbers of men and women that are overweight and need the surgery, but about 80% of our patients are women. Obesity itself is a very high risk factor for premature death and morbidity. In fact, if you have a BMI over 40, it's recommended that you have the surgery without any medical problems. And so I don't want to imply that you have to have diabetes or high blood pressure or sleep apnea or high cholesterol, all these things that are improved with bariatric surgery to have it done. We've also got some literature that shows it prevents some of these medical problems like high cholesterol and diabetes and these other medical problems that we're trying to resolve.
Watch more videos on bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.